Well, back to school and back in the game. There's nothing quite like participating in a school team sport. But athletics, of course, not without risks. In fact, high school athletes alone sustain more than 3 million injuries every year. That is 3 million. Dr. Mark Greenberg of All-Star Orthopaedics and Sports Medicine knows how to prevent sports injuries. Dr. Greenberg, great to see you.
You too, Chris.
Let me ask you, where does injury prevention start?
Well, injury prevention really begins with the pre-participation physical. And that's an opportunity for the physicians and trainers to assess the athletes for any problems that have lingered from last season, any medical issues, and really be proactive about trying to address those injuries before they head out on the field.
So before they head out, when they should start, the athletes start preparing to play?
Well, these days most of our athletes condition year-round, so that's a great thing. But for sports-specific training, we really recommend about 6 or 8 weeks to start really ramping up their exercise. The key is to do it gradually, allow the body to adjust to the increased stress, and especially with the heat, to acclimate to these really hot conditions we're having. So
what are some things specifically we should do before stepping out onto the field to decrease the injury to these athletes, the risk of injury to the athletes?
Well, first of all, we want to make sure that the athletes check their equipment, helmets, shoulder pads, especially for football, make sure they're in good repair and that they fit well. The athletes need to really start hydrating themselves. If they're not hydrating before the day of activity, they're already behind. And as Larry North has brought to light earlier, nutrition's a big thing, and we want to make sure they're fueling the engine.
Speaking of hydrating, how much water, Gatorade, should these athletes be drinking if they're heading out onto the field?
Well, the day prior, they should be maxing out on their water intake to where they hardly want to look at another glass of water. And then, every 20 minutes or so between breaks in practice, they should be hydrating up again. And the athletic trainers are really stressing that to all our athletes right now.
So after the games, in between practices, off days, just keep hydrated as well.
Absolutely. Between activities, the body needs rest. It's got to rejuvenate, rehydrate. And especially in the heat, it takes longer to recover from the stress of exercise.
Right.
So that extra rest time is really important.
You see a lot of athletes, especially young athletes, they suffer an injury. They may not want to come out. They want to keep playing. Of course, it's dangerous. What should an athlete do if he or she is injured?
Well, most athletic events have some pain involved as part of the activity. So first of all, they need to listen to their body. Mild pain is something we certainly accept and live with in sports, but any kind of severe or prolonged pain, any kind of injury that has swelling, difficulty bearing weight, they need to report that to the coach or their trainer. And from the trainer or coach's standpoint, they're going to look to referring that patient to a medical professional, an orthopedic surgeon or team physician that can really evaluate and treat their injury.
Excellent. Dr. Greenberg, terrific information. We have so many young athletes, high school athletes heading back to school, and they're on the practice field now. Great information. We appreciate it.
My pleasure.
Good seeing you. All-Star Orthopaedics and Sports Medicine has locations in Las Colinas, South Lake, also Flower Mound. For more information about sports injury prevention, call this number 972-556-2886 or log on to allstarortho.com. You can also find out much more by calling Pine Creek Medical Center. That number 214-231-CARE 2273 or online at pinecreekmedicalcenter.com.